I am Shrinath Reddy, President of the Public Health Foundation of India. I am a cardiologist with training in public health, and during the course of my professional career, both as a clinician and as a researcher, I've become very clearly aware of how disordered nutrition impacts upon health and can result in a wide variety of diseases, especially those of the heart and the cardiovascular system. Nutrition is important at every stage of human life for good health and well-being. It starts even before one is born or even before one is conceived, based on what the nutrition of the prospective mother is and how the maternal nutrition was maintained during the period of pregnancy and later on during lactation as well. But then, apart from the influences of maternal nutrition on early childhood development, we find that child nutrition is very critical for protecting against a variety of infectious diseases, ensuring also that apart from good physical growth, there is good brain development and cognitive growth. As the child grows in adolescence and later on in young adulthood, we find that the importance of nutrition continues. In fact, it continues all across life, whether it's an adult trying to protect oneself from a variety of dietary-related chronic diseases such as heart diseases, cancers, and diabetes, or the elderly trying to lead a fully fit and functioning life rather than becoming frail and feeble. While the importance of nutrition for health has been fairly well recognized, and the problems associated with both malnutrition, of undernutrition, as well as inappropriate nutrition resulting in overweight and obesity, are also now clearly being documented. Nevertheless, the relationship of nutrition security to food and agriculture systems across the world has not been well understood, or at least it's not been reflected in national and global policies. The production of food, the processing of food, the pricing of food, the distribution of food, the availability of local foods, particularly natural foods which are not ultra-processed or basically exposed to multiple toxins. This aspect also needs to be looked into if one has to ensure nutrition security and nourishment across all of life. This particular consultation, which is developing a manifesto for protection of human health through good nutrition, is looking at all of this connectivity and trying to see how food and agriculture systems, as well as policies which regulate as well as guide the availability and access and affordability of food to every person, can actually be much more sensitive to public health concerns and see that nutrition security becomes an essential element of human health and sustainable development. There are multiple determinants of health, and nutrition is one of the key elements which connects several of those. Indeed, if nutrition suffers, we will find that not only health is immediately threatened, but the ability to access education, the ability to get good livelihoods and perform work, and the ability to have a good reproductive life, all of these are affected with impaired nutrition. And therefore, nutrition is a key element of human well-being. And food security and nutrition security should be regarded as a human right. And if agriculture and food system policies are not sensitive to that right, not respectful of that right, then we will find a lot of inequalities in availability of nutrition security to people across the world. and several disorders will result, threatening the health, and we must ensure that health becomes a very important element of framing food and agricultural policies anywhere in the world. But particularly, we have to emphasize the importance of locally available and easily affordable natural foods, because we now recognize that many of the processed foods, particularly the ultra-processed foods, or foods which are also now contaminated with a variety of toxins and endocrine disruptors which reduce immunity and disturb hormonal function, all of these have entered our food chain. And we should now try and eliminate some of these harmful influences from the food chain so that they do not adversely affect human health. I believe this particular consultation is very important in bringing people from diverse sectors, from multiple disciplines, to examine this very vital issue of human development and trying to put together a manifesto which reflects human aspiration for good nutrition and good health for everybody, but ensuring that perspectives of multiple stakeholders are reflected in a common commitment to that cause.